name is Kim Meyer, and I'm from the University of Mississippi for Women. And today we're here to talk to you about insulin-dependent diabetes. And we're going to go through several objectives to let you know what we want you to learn. The first thing is we want you to be able to recognize signs and symptoms of insulin-dependent diabetes with 90% accuracy. We want you to be able to identify the risk factors for the insulin dependency with 85% accuracy. We want you to be able to recognize the symptoms of the body that may be affected by insulin-dependent diabetes with 85% accuracy. And be able to identify proper testing to diagnose insulin-dependent diabetes with 85% accuracy. We also want you to recognize various treatment options for the patient with insulin-dependent diabetes with 85% accuracy. We also want you to be able to understand the importance of patient and family education with 90% accuracy. Understand that insulin-dependent diabetes can affect family members with 85% of accuracy. And we want you to recognize that insulin-dependent diabetes can be a great burden on the family as much as the patient with 85% accuracy. The definition of insulin-dependent diabetes is basically diabetes 1 or juvenile diabetes. It is a chronic disease that affects the pancreas. It also is basically kind of unknown what causes the symptoms or causes the disease, but it's thought to be a bacteria or a virus that affects the pancreas that causes the insulin-dependent diabetes. In most cases, the immune system of the body destroys the insulin, producing insulin cells in the pancreas. It is also thought that it may be genetically linked to parents or past family members. The insulin cells are basically destroyed, and the pancreas decreases the amount of insulin made or does not make any at all, which causes a buildup in the blood system. Insulin is a hormone that is in the body, requires that needs to be allowed for entry of sugar or glucose into the cell, which will make the energy for the body. Insulin lowers the amount of sugar in the blood, which lowers the overall blood sugar level and decreases insulin secretion from the pancreas. When there is little to no insulin made, the sugar will build up in the blood. This can cause serious complications, and with type 1 diabetes, it usually affects children and adolescents, but it is known to also affect adults in some cases. About the history of diabetes, or insulin-dependent diabetes it is, they have actually symptoms have been documented for thousands of years. The earliest documentation was in 1552 BC. They actually by this Hesse Rahl Mercatus, and he diagnosed that there was urinary frequency in patients. Other symptoms were noted in the 11th century, when diabetes was thought to be the sweet tasting disease. And what happened is you had urine tasters who would go in and test the urine of these patients, and it had a sweet taste to it, so in that way they thought that they had this sugar disease. In the 1900s, we found that the two doctors, Dr. Allen and Dr. Johnson, were considered to be the leaders in diabetes specialty. Dr. Allison went as far as permitting strict diets for his patients to see if he could help with the problem. A drug company and the University of Toronto actually started producing insulin in mass quantities in 1922. Through the early and mid-1900s, advanced treatments and studies continued, and in 1970, the first glucometer was sold for about $500 to the first doctor's office. Now they're much, much cheaper, and the patients can also have them to use to check their blood sugars on a daily basis. In 1973, the insulin was set on the market with the U100 and was produced in 1976. A1C testing was begun. Through the years of the 1970s, the present research and studies continue to be done to provide patients with the best care they possibly could get. And also, we're going to also look at several other things today, since we're talking about glucometers and insulins. I did want to give out a few handouts today. The first handout is going to be on subcutaneous injections. It actually helps you and the patient, that you can give it to them, on where they actually can inject themselves with insulin when they start using it. And it's a good guide for them to use in the futuristic also, because it gives them all the different locations. They can do it in the arms, in the back, in the stomach, the thighs. And this handout also can be used because it actually tells you step by step how to give the insulin. By washing the skin off with alcohol, by actually squeezing the skin before putting in the insulin. So this is a very good, effective tool, very efficient for patients, very easy to understand. Also, I want to talk about a few things with the insulins. We have insulins now, they're in bottles. Insulins can be used daily, twice daily. They can be used before meals. They can be used at bedtime. And this is one of our insulins that we use once a day. It's usually given at night, and I'd like to show you how to use it. The very first thing is you're going to pop the top off, which I'm not going to do today because I don't want to take the sample and not be able to give it to a patient. But you'll pop the top off. You'll take your alcohol pad and you'll swab it and make sure that it's clean. You'll also tell your patients to do this. You'll take this very small, fine needle. Most patients can't even feel it once they inject themselves. But let's just say they're on 10 units. You'll actually take it, pull back your 10 units of air, inject it actually into the bottle, hold your bottle back up, and pull back 10. Now I like to pull back on the level of 10 a little bit further than that. Make sure that I got all the bubbles out. And once my bubbles are out, I will push it back, whatever's left over, back up into the bottle of 10. Just make sure I have no bubbles in my syringe whatsoever. And this will be very effective for your patients to know, because they don't want to put air into their bodies. They're kind of scared. They hear these horror stories about it. So we want to make sure they're as accurate as they can be with their insulins, because it is such a small amount when you really think about how much you're giving them in some of these syringes. Another type of insulin that can be used is in a flex pen. And these flex pens, there's all different brand names, and it actually looks like a pen. And when you pull this out, all you have to do is tell the patient to get their little needle, take the little tab off, stick it on here, then they'll have it on the pen, and they'll dial on how many units that they need. Once they do that, then they can go ahead and they're ready to inject it. And the easiest way to inject it is to when you wipe off the skin, say with a piece of alcohol, then you'll have them pinch the skin up, which if you use this, you'd wipe it, pinch the skin up, inject the needle, and push it in. And I like to let them hold it for a few minutes, or a few seconds, just so they get all the medicine out. Okay, and then the last thing we're going to talk about is the collars, which our patients can have now. Basically, they're going to clean the skin well. They're going to take their little strip, place it into the glucometer until the little numbers pop up, wipe their skin and do it with alcohol, inject, and this is going to ask them for blood. They'll stick it on here. It'll tell you when they have enough, and then it reads the time will go down until it reads the accurate blood sugar check. We do like patients to check their sugars, and for your information, at least before they eat or 2 hours after they eat for the most accurate blood sugar reading. But the very best one is going to be in the morning before they eat or drink anything. And you want to always make sure they do their controls ever so often too, to make sure their glucometer is working correctly. Thank you.